Hey guys, it's Danielle with Pure Root Wellness. Today the topic is going to be high cholesterol and ways holistically that you can improve your own cholesterol. So talking numbers real quick, on the right you can see just kind of a guide of total cholesterol, low density lipoprotein, high density lipoprotein, and triglycerides, and kind of the ranges that typically when you go get a cholesterol panel taken, what your numbers, where they should kind of fall. Cholesterol really is just, it's a lipid, and it serves a lot of beneficial functional purposes in the body, one being nerve function, and helps to develop good hormones that our body obviously needs to survive and thrive in a healthy way. But we come to find that cholesterol start to rise when patients come in and they have a diet really high in animal product, high saturated fats, refined carbs. This all really contributes to the development of high cholesterol. Obviously, there are some hereditary conditions that can also cause high cholesterol levels, but a good majority of the patients, it's really more so a dietary component that has led up to the numbers that have, kind of shown up. So the lipoproteins, the LDL and the HDL, are really the transporters of cholesterol into the bloodstream. So the LDL is what carries the cholesterol from the liver to the cells for use. This is typically what we deem the bad cholesterol. And then the HDL actually picks up the excess from the blood and brings it back to the liver. So kind of the cleanup lipoproteins, if you want to call it that. And this is what we deem kind of the good cholesterol. Usually this process keeps the cholesterol in balance, but when the body really becomes overwhelmed with the HDLs, just can't keep up with the cholesterol, and it stays in the bloodstream instead of actually being used for a cellular function. Now, when the cholesterol stays in the bloodstream, it eventually becomes oxidized, and when this happens, it'll begin to attach to the arteries and the arterial wall, and this ultimately will lead to the process of hardening, stiffening of the arteries themselves, which unfortunately and subsequently can lead to heart attacks, strokes, and peripheral artery disease. So really kind of getting into the plan. Well, the first place to start is obviously the diet. Fiber, high fiber diet with veggies, fruits, nuts, seeds, whole grains. Soluble fiber is really the best. This is fiber that doesn't dissolve in water. It binds to the cholesterol in the digestive tract. So oat bran, oatmeal, you're looking at one bowl a day for 3 weeks, and this can actually help to reduce the cholesterol up to about 20%, which is kind of impressive just from looking at it from like a digestive, standpoint. Ground flax seeds, apple, the pectin in the apple, olive oil, this can all actually increase the good cholesterol. Canola oil, flaxseed oil has been known to do this as well. Garlic and onions, they have been researched and found that it can lower LDL, raise your HDL, your good cholesterol. So always adding in some garlic or onions to any of the meals is always beneficial. Cayenne, basil, rosemary, oregano, all of these have really good antioxidant properties to really prevent the cholesterol oxidation that we talked about that promotes the stiffening of the arteries. Strawberries kind of fall into this as well. So something really to take into account and, incorporate in foods in your everyday kind of diet plan. Now, the avoid list is pretty obvious, but, have to throw it out there. If the label says saturated, hydrogenated, partially hydrogenated, it's no bueno. It's no good. This will not help any form of your cholesterol, if not harm your cholesterol numbers. Fried foods, the sweet baked goods, vegetable shortening lard, even alcohol will stimulate the liver to even produce more alcohol. Egg yolks are really, an excessive amount of egg yolks. It will eventually start to cause issues with your cholesterol numbers as well. And then excess consumption of caffeine. This has actually been linked to high cholesterol. So you're really only looking at limiting about 1 to 2 cups per day of coffee or tea. And I won't really get into, the energy drinks. This is kind of a different topic that I'll talk about in a different podcast. But really limiting, your energy drinks. They're just chock full of caffeine. They have no nutritional benefit whatsoever to your body. So even just not looking from a cholesterol standpoint, just avoiding those high potent energy drinks would be good for your overall health. So what kind of supplements do we look at? Some natural holistic approaches to helping your cholesterol. Niacin has been a long-standing researched supplement where it can actually lower your LDL by about 25%. Your triglycerides can be cut in half, and your HDLs can actually be increased by about 35%. So it does have a lot of natural properties that can help with your cholesterol numbers. The problem is a lot of patients have issues with the side effects that come with it, the skin flushing, that vasodilatory effect that happens with niacin. But honestly, this can easily be taken care of by changing the formula itself, choosing a different compound like the nicotinamide or something that has a little less side effect of that flushing, and people truly respond just as well. Red yeast rice is another supplement that has also been pretty extensively researched, showing that a reduced in total cholesterol can be about 11 to 32%. Your triglycerides can get up to about 19%. You really need to be cognizant that you're taking a coenzyme Q10 with red yeast rice. The red yeast rice can actually cause a depletion or deficiency in the coenzyme Q10 enzyme. And really this enzyme is very important for heart and muscle health, processing fats, removing toxins from the body itself. But I think it's important to know if you are gonna kind of hang your hat and use red yeast rice that you need to be supplementing with the coenzyme Q10. And really, when you're talking about, every patient, a good majority of the patients that I have, they're all on a statin. It's like the most prescribed, medication, westernized medication that a majority of Americans are on. These statins, these common cholesterol lowering medications, work really by inhibiting the liver enzyme, HMG coenzyme A reductase. By blocking this enzyme, the liver will actually synthesize cholesterol. And this same enzyme actually promotes the use of coenzyme Q10 in the body. So just kind of a roundabout way where if you're taking the red yeast rice, this is very important, to supplement with the coenzyme Q10, and how that kind of comes full circle in regards to comparison of a statin per se. Fish oil is something else that's very beneficial to incorporate from a cholesterol lowering capability. It's really, fish oil is the standardized treatment for both conventional and alternative treatment for high triglycerides. It can cut trigs really in half. So finding a good quality fish oil supplement is very important. I would definitely recommend not going into a common drugstore or a local grocery store and trying to find a fish oil. This is something where I would pay a little more bang for your buck and get a good quality fish oil. If this is the route you choose to take. We talked a little bit about garlic. You can, if you're not adding it from a dietary standpoint, you can add it from a supplementary standpoint. And then artichoke extract has also been shown to have some cholesterol reducing properties as well when supplemented. So just finding, a good multivitamin with B5, vitamin E, vitamin C, chromium picolinate. These all assist really in cholesterol lowering processes, either directly or indirectly by the antioxidant kind of process. Here are the references for this. I hope this was helpful, just kind of short and sweet on natural and holistic ways to help lower your cholesterol, keep it low. I hope this was beneficial. I hope you all are doing well and be well.